Good afternoon. I am Kyung Byun, Assistant Professor at Department of Radiation Oncology at Yongin Severance Hospital. I would like to discuss the management after radiation therapy for breast cancer patients. First, let's take a brief look at the process of post-radiation treatment. So first, you have counseling with the physician and you have the CT scan of the treatment site for radiotherapy planning. Once the ACPs complete radiotherapy planning based on the CT scan, then radiation therapy will begin. During the CT scan for planning, in other words, during the mock treatment, imaging of the radiotherapy field is taken. And at this time, the reference points for the treatment are drawn on the body, and if necessary, fixing apparatus is made. And based on the CT scan, the ACPs will design the radiotherapy. First, the responsible physician will go over 200, 300 CT scans in order to precisely draw the target around the lesion and adjacent normal organs. And then, using the computer calculation, the dose distribution will be determined based on the optimal radiation beam and the number of the beams. And then there will be verification step to see if the radiation is shot according to the plan. And so there is precise design of the radiation therapy customized to the breast shape of individual patients. Once design is complete, radiotherapy will begin. And you cannot give all of the doses at once, so the principle is to fractionate. In other words, to spread out the therapy to daily doses over time. Usually, it's once daily and 5 days during a week, and each treatment session is short, between 5 to 15 minutes. That was about the process of radiotherapy. Let me now go over the side effects and the management of the radiotherapy in breast cancer patients. There are 3 different scope or coverage of radiotherapy. Patients with lymph node metastases generally receive radiotherapy not only on the breast but also the axillary lymph node and the supraclavicular lymph node. Those without lymph node metastases will have the whole breast irradiation only, and those in their very early stages will receive the radiation only around their surgical site, which is called partial breast radiotherapy. And radiotherapy is local treatment. Therefore, please remember that the side effect and the effects are only affecting the radiated field. So there are some misperceptions that radiotherapy leads to loss of hair and vomiting, but those who receive radiotherapy only on their breasts, they don't receive it on their heads. So there is no reason for loss of hair, and the symptoms will be limited to the breast area. Side effect to radiotherapy in breast cancer can be divided into acute side effect and late onset side effect. Acute side effects include fatigue, radiation-induced dermatitis, breast edema, pain, axillary hair loss, and esophagitis. Acute side effects are quite common, and they may occur during radiotherapy or right after therapy, and they will be resolved within 1 month in most cases. Late onset side effects include pain, chest induration, lymphedema, and radiation-induced pneumonia and cardiotoxicity. Late onset side effects occur less frequently, but they can occur several months to several years after the completion of the radiotherapy. Now, I went over various side effects, but most of the side effects from radiotherapy are very mild. And in general, they are much more tolerable than the side effects for chemotherapy. Therefore, there's no need for you to be too scared. So let me go over each of the side effects one by one. First is radiation-induced dermatitis. The radiation-induced dermatitis will include itching, redness, and exfoliation, and redness, dryness, and hyperpigmentation in the radiation therapy site. In particular,
겨드랑이, 유방 밑에 더 심하게
areas where
발생할 수
skin
있습니다.
folds, for example, the axilla and
장사성
under the
피부염은
breast,
대부분 치료
these
후에
symptoms
한
may
달
be
이내에
more
회복됩니다.
severe. The dermatitis
다만
will be
색이
resolved
어두워진
within 1
것은
month in most
여름에
cases.
바캉스에서 찬
However,
피부색이
the dark
돌아오는데
skin
몇 달이
will be
걸리듯이
similar
색이
to
완전히 돌아오는 데에는
how the suntan
수개월에서
from your summer
수년까지 걸릴 수가
vacation
있습니다.
may take some time to disappear. So it may take
장사성
several months to
피부염을
several
줄이기 위한
years for
피부
your
관리
skin
방법을
color to come back to
말씀드리겠습니다.
normal. Let me
가장
talk
중요한
about how
것은
to manage
보습제를
your
잘
skin in
바르는
order to
것입니다.
reduce radiotherapy-induced
보습제를 바를
dermatitis.
때에는
The most
몸에
important
그려진
thing is
구준선을
to
피해서
apply the
바르는 것이
moistures
좋고
regularly.
치료 직전에
And
바르는
when
것은
you
좋지
apply the
않고
moisturizer,
치료
please
후에 바르는
avoid the
것이
reference
좋습니다.
points on your body and
장사선
apply
치료가
it
끝난
after
후에도
treatment and not
지속적으로
before.
보습을 하는 것이
And you should
좋겠습니다.
continue applying the moisturization
알코올이
even
함유되어
after
있지
completing
않은
your
관리의 젤을
radiotherapy.
바를 수 있습니다.
You can also apply aloe
장사선 피부염 증상이
gel, which
심한
does not
경우에는
include alcohol.
주치
If
상의하에
your
스테로이드 크림을
radiotherapy-induced
처방받아
dermatitis
바를 수
symptoms are
있습니다.
severe, it is possible for you
치료
to get
부위
steroid
때를
creams
늘거나 문지르지 말아야 합니다.
prescribed from your
그리고 자극을 주지
treating
않도록
physician.
면으로 된
And
속옷을 입는
you
것이
should not
좋고
exfoliate or rub
뜨겁거나
against the
차가운 것을
skin.
대면 안 됩니다.
And also, you
특히
should wear
온탕,
cotton
사우나,
underwear
핫팩,
to
얼음팩을
not
피하는 것이
irritate your
좋겠습니다.
skin. And please avoid
치료 후
too
외출
cold or
시에는
too
선크림을
hot
바르는 것이 좋습니다.
contact. And please avoid hot sauna or hot packs or ice packs
다음은
and
피로감입니다.
apply sun cream
치료
when you go
중에
outside.
경미한 피로감이
Next is
나타날 수
fatigue.
있습니다.
You may develop
이는
mild
방사선뿐만
fatigue during
아니라
treatment.
함께 받는
This may
항암치료,
be not only due to
항호르몬 치료,
radiotherapy,
표적
but
치료로
also
인해서
due
복합적인
to
원인으로 나타날 수
chemotherapy,
있습니다.
anti-hormone therapy, and targeted
방사선
therapy.
치료로 인한 피로감은
So it may be a
대부분 치료
result
종료
of
후에 2,
a
3주 내에 호전이 됩니다.
complex set of causes. And the fatigue due to
다음은
radiotherapy will
통증입니다.
improve within 2 to 3
수술
weeks
부위에
after
콕콕
completing your
쑤시고
treatment.
열감이
Next is
있고
pain.
찌릿찌릿한
After
통증이 나타날
surgery,
수
you
있습니다.
may feel
주된 원인은
this
수술
tingling,
시에
heat
미세한
sensation,
신경들이 잘리기
and
때문에
these prickling
발생합니다.
sensations. Most of the
이러한
pain
통증은
come
유방
because the
절제술 후에
micronerves are
20에서
compromised during
60%까지
surgery,
경험하는
and the
흔한
pain
증상입니다.
is a common symptom
대개 통증이
experienced by
나타나면
20
몸에
to
이상이 있을까 봐
68%
걱정하시는 경우가 많습니다.
post-mastectomy. And
하지만
many patients are
유방 치료
concerned
후에
about pain
통증을
because
겪는 것은
they think that
일반적으로
it may
흔하게 나타나는
signify some
증상이므로
problem in their body,
과도하게 걱정하실
but
필요는
pain
없습니다.
post-mastectomy is common
통증은 수술
symptom, so
후에
there's no need for you
10개월에서
to be excessively
수년까지
worried.
오랫동안
Pain may
지속되기도 합니다.
persist for several months to several years after the surgery.
다음은 가슴이 단단해지는
Next
섬유화,
is the
경화증
fibrosis, the
증상입니다.
induration of your chest.
일반적으로
In general,
수술한
the
부위가
surgical
단단하게
site
만져지는
will
것은
feel very
정상적인
hard to the
소견입니다.
touch, and that is a normal
상처가 나면
finding.
흉터가 남듯이
It is
안에서
similar
유방
to
조직을
how
떼어내고
you have
나면
a scar
일종의
after a
흉터가
wound.
남는데
So when you
그것이
remove the
단단하게
breast
만져지는
tissues,
것입니다.
there is sort of a scar left,
이것이
and
더
that is what
심해지면
it
유방
feels
조직이
hard
일부
to the touch.
단단해지는
And if it
섬유화,
becomes worse,
경화 증상이
then you may
나타나기도
develop
합니다.
symptoms of fibrosis or
단단해지면 부드럽게
induration where
풀리는
the
데에 수개월에서
breast
수년
tissues
정도의
are
시간이
hardened,
걸립니다.
and it may take several
그리고
months to several
고성량의
years
방사선이
for the
들어가는 부분은
induration to
섬유 가능성이
become
높습니다.
softer again. And also, it is more
세브란스
likely
병원에서
to have
유방 방사선
fibrosis
치료를
in the
받은 101명을
high-dose
분석했을
radiotherapy
때
field.
6%에서 이러한
The
섬유화,
analysis of
경화 증상이
101
나타났습니다.
patients who
하지만
received
대부분 가벼운
breast
증상이었고
radiotherapy
금방
at Severance
회복이
Hospital
되었습니다.
developed the fibrosis and induration in 6%,
다음은
but they
림프
were mostly
부종입니다.
mild symptoms and
수술한
they
쪽에
recovered
손과
quickly.
팔이 붓는
Next
림프
is
부종이 나타날
lymphedema.
수 있습니다.
Lymphedema may develop
시기는 수술
on
후
the
평균 1, 2년
ipsilateral
내에
arm and
나타나고
hand, and they
빈도는
may
전체
develop on
환자의 약
average
15에서 20%에서 나타납니다.
within 2 years since
림프
surgery,
부종에는
and
여러 가지
the frequency
원인이
is about
복합적으로
15 to
작용합니다.
20% of all patients.
가장 영향이 큰
Various
것은
causes come into
겨드랑이
play
수술입니다.
to develop
림프절 절제
lymphedema.
개수가
The
많을수록
biggest factor
림프
is
부종이 나타날
axillary
확률이
lymph node
높습니다.
dissection. The more nodes are
애가저하고
removed, the
곽성술이
higher the
아니라
odds are
임시림프절
of
생관만
developing
시행한
lymphedema.
경우에는
When
림프절
you
절제
only
개수가
had
적기
sentinel
때문에
lymph node
림프
biopsy
부종이
instead of
나타날
axillary lymph
위험성이
node
적습니다.
dissection, it is less likely for you to have
항암제의
lymphedema
경우에 탁사인계
because the number
항암제를 쓸
of
경우
removed lymph
그리고
nodes
방사선
is
치료를
smaller.
하실 때
And if you
겨드랑이
use
림프절 조사를
taxane
한 경우
chemotherapy, and if
그리고
you had
비만인
axillary
경우에
lymph node
림프 부종이 더 잘
irradiation, and
나타납니다.
if you are obese, it is more likely that you will develop
이렇게
lymphedema
사진에서
post-mastectomy.
보듯이
As you can
반대쪽
see in the
팔에
photo,
비해서
compared to the
수술한 쪽의
contralateral
팔에
arm, the ipsilateral
둘레가
arm
커지고
circumference will
붓게
increase,
됩니다.
and there is swelling.
증상은
And
수술한
the
쪽
symptoms
손과 팔에
include
뻐근한 느낌, 압박감,
sourness and
부종,
pressure,
쿡쿡
edema,
쑤시는 느낌,
prickling,
열감,
and heat sensation.
그리고 피부를 누르게 되면 잠시 그
And
상태가 유지된 채로 있고 피부가
when you
바로
press your
되돌아오지
skin,
않는 현상,
it will remain depressed and will not return to normal. There also may be rash and inflammation on the ipsilateral hand and arm. When there is rash and inflammation, it may signify possible infection. Therefore, you should consult with a specialist right away. To prevent lymphedema, you need to be careful of the following. First, please be careful so that you don't have any wounds on the ipsilateral arm. Please keep your skin clean and pay attention to your personal hygiene in order to prevent infection. And also, please avoid using too much force on the ipsilateral arm muscle. However, not using your arm at all will backfire. It's not good either. So use your arm naturally and have regular exercise at appropriate intensity. However, you should avoid lifting very heavy things or doing excessive manual work. Also, you should avoid anything that interrupts your circulation. For example, tight clothes or accessories may bring about too much tension on your ipsilateral arm, and it may get in the way of the circulation of the lymph. Therefore, that should be avoided. Also, you should maintain appropriate weight and be careful when you have injection or blood drawn from the ipsilateral arm. But there's not consensus regarding injection or blood sampling. The American Society of Breast Surgeons and the International Society of Lymphology have announced that it's not contraindicated to measure blood pressures or take blood or have injections. So if possible, try to get injections and blood samples taken from the contralateral arm. But in inevitable cases, I think it will not be a big problem even if you do it in the ipsilateral arm. When there's lymphedema, we have the complex decongestive therapy. Complex decongestive therapy is a combination of various treatments. First is compression therapy using bands or stockings, physical exercise therapy, and skin treatment to manage the wound, and also lymph drainage based on massage. So when you have lymphedema, the lymphedema will be controlled using the combination of different therapies. After, let me talk about the pneumonitis-induced pneumonia, the radiation-induced pneumonia. So about 3 to 6 months after completing radiotherapy, you may develop symptoms such as dry cough or dyspnea or shortness of breath at rest. The symptoms are mostly mild and are resolved spontaneously. But sometimes when there is severe symptoms, you might have to take oral steroids. Therefore, after completion of the treatment, if you become symptomatic at 3 to 6 months later, then you should see the doctor. Let's take a look at the following case. This is the breast, and what appears black is the lung. And this colored area in the breast is where the radiation is shot. And this patient developed inflammation in the lung almost identical to the irradiated area after 6 months. So this is a finding that can be interpreted as radiotherapy-induced pneumonia. And after taking oral steroids and taking CT scan 5 weeks later, the patient recovered from the radiotherapy-induced pneumonia. Now, the radiotherapy-induced pneumonia frequency can be reduced using IMRT, intensity modulated RT, which is more sophisticated radiotherapy. There was an analysis of patients who received radiotherapy in Severance Hospital. In total, 1,847 of them were analyzed, and the radiotherapy-induced pneumonitis incidence was about 3 to 5% during the treatment, and when there was IMRT, it was very low at 0.7%. The reason is as follows, shown in the picture. The lung is shown in black, and the colored area in front is the irradiated field. And if it's a routine 3D radiotherapy, then the irradiation is a simple straight line. So the interior part of the lung will be irradiated. However, if it's intensity modulated radiotherapy, the irradiation can be more precisely targeted. Therefore, the irradiation beam will be following the curvature of the lung, along the curvature of the lung. Therefore, the lung will receive less doses of irradiation, which
다음은
means that
심장
the
걱정에 대해서
incidence of the
설명드리겠습니다. 왼쪽
radiotherapy-induced
유방의
pneumonia will
경우에는
be reduced.
바로
Let me
뒤에
talk about
심장이 있습니다.
cardiotoxicity.
따라서
There
왼쪽
is the
유방의
heart
방사선
right
주사를 할 때
posterior to the
심장에 어느
left-sided
정도
breast.
방사선 치료가
So
방사선이
if you're
들어갈
getting
수밖에
radiotherapy
없습니다.
on your left side
이렇게 왼쪽 유방
breast,
방사선
then
치료
the
시에는
heart will also
근육에 심장
receive a
곡성이
little bit
발생합니다.
of the radiation dose, which will,
방사선으로 인한
on
심장 곡성은
occasion,
당장
develop
나타나는 것이
into
아니라 주로
cardiotoxicity.
5에서 10년 후에 나중에
Cardiotoxicity is
나타나고
not
빈도는
acute.
5% 정도로
It appears
높지는
about 5 to
않습니다.
10 years after
심장
completion of
곡성에는
the radiotherapy,
방사선뿐만
and
아니라
the incidence
다양한
is not
요인이
high. It's about
관여합니다.
5%.
허세핀,
And various
아드리아마이신
factors
같은
contribute to
항암제, 당뇨,
cardiotoxicity in
고혈압,
addition to
흡연,
radiotherapy. For
비만,
example,
운동
Herceptin
부족,
and
심질환 과거력,
adriamycin and other chemos, as well as
따라서
diabetes,
이렇게 위험
hypertension,
인자를 가지고
smoking,
계시는
obesity,
분들은
lack of
위험 인자를
exercise, and
줄이려는
history
노력이
of
필요하고
cardiac diseases are
정기적인
involved.
심장 검진도
Therefore, if you have
필요하겠습니다.
such risk factors, you should make the effort to reduce them and also have
New
regular
England Journal
screening
of
of your heart.
Medicine이라는
In
주요한
New
의학
England Journal
저널에
of Medicine, which is
2013년도에
a
발표된
seminal
바에
medical
따르면
journal,
심장에
there was a
분석되는
publication in
방사선 설량이
2013
1g씩
saying
늘어날
that
때마다
with
주요
one
관상동맥
grade
질환 발병
increase in
위험도가
the radiation dose to the
10.4%씩
heart, there
증가한다고
is
밝혔습니다.
7.4%
이것을 보고
likelihood
굉장히 걱정이 되실
of
텐데요.
increase for
하지만
major coronary
심장 방사선
event.
주사량은
You may be
수술
concerned when
기법으로
hearing this.
효과적으로 낮출
However,
수가
you
있습니다.
can effectively reduce the dose
이
to the
사진은
heart
세기조절 방사선
using
치료
the
기법을 이용한
latest
것인데요.
technique. This
일반
photo
3차원
is
방사선 치료
using the
시에는
intensity modulated
일직선으로
radiotherapy.
주사해서
So
바로
the
뒤에
routine
있는
3D radiation
심장에
will
약간의 방사선이
be
들어갑니다.
following
하지만
a
세기조절
straight
방사선
line
치료의
path,
경우에는
and so the
유방
heart
모양이
will
거의
receive a
비슷하게
little bit of
정교하게
the radiation dose.
이렇게 유방에 있는
However,
방사선에 집중하게
the
되고요.
intensity
뒤에
modulated
있는 심장과
radiotherapy
폐에는
will
더 적은
follow very
방사선이 주사가
precisely
됩니다.
the
따라서
curvature of
세기조절
the
방사선
breast,
치료라는
and
시술
therefore
기법을
the
통해서
doses will be
심장
concentrated
방사선
on the breast
주사량을
itself,
감소할 수가
and less
있습니다.
doses will be delivered to the heart and
또
lung,
다른
which are
방법으로는 호흡
posterior
조절
to the
기법이
breast.
있습니다.
So
이
IMRT
사진은
can reduce the dose that
DIBH라는
is applied to the heart.
호흡 조절
There's
기법을
another
사용한
method
사진입니다.
called DIBH,
일반 방사선
deep
치료 시에
inspiration breath
비해서
hold, and here is a
DIBH를
photo.
사용했을 때는
Compared to
숨을
routine
크게 들이마시고
radiotherapy,
참기
when
때문에
you apply the
유방과
DIBH, you
심장
take a
사이의
deep
거리가
breath
떨어지게
and you
됩니다.
hold. Therefore,
따라서
the distance between the
방사선을 주사할
breast and
때
the heart is
심장에는
widened.
거의
Therefore,
방사선이
when the
도사되지 않는 것을
radiation
볼
is
수가
delivered,
있겠습니다.
uh,
이렇게
there is
심장
almost no
방사선
dose
주사량을
delivered to the
세기조절
heart.
방사선 치료,
So
호흡 조절
you can
기법으로
effectively
효과적으로 낮출
reduce
수가
the
있습니다.
doses to the heart using the IMRT and the
다른 심장
DIBH
관련 위험
techniques.
인자도 주의해야
Next, you should be
하겠습니다.
careful about the
세브란스병원
heart-related
유방암
risk
환자
factors.
1293명의 대상으로
Analysis of
분석했을 때 심장 관련 위험
1,294 breast
인자는
cancer patients at the
당뇨,
San Francisco
고혈압,
Hospital.
운동 부족으로
Cardiac-related
나타났습니다.
risk factors
이
were
위험 인자가
diabetes,
없거나
hypertension,
한계만
and lack
있는
of exercise.
저위험군과 두세 개 있는
Patients with
고위험군을
the low
비교했을
risk
때
group with
심장
0 to 1
심실환
risk factor
발병률은
compared with the high risk
저위험군에서
group with 2 to 3
4.7%,
risk factors,
고위험군에서
there was about
10.5%로
twofold
두 배
difference
정도
in
차이가
terms of
났습니다.
the 10-year cardiac
따라서 당뇨,
disease
고혈압
development
같은
in our
위험 인자를
research, with
적극적으로 관리하고
4.7% at the
규칙적으로
low risk
운동을 하는
group and
것이
10.2% at the
중요하겠습니다.
high risk group. Therefore, you should proactively manage your risk
이상으로
factors such as
방사선
diabetes,
치료 후에
hypertension, and
급성
exercise
부작용과
regularly.
후기
So we
부작용을
took the look
살펴보았습니다.
at the acute side
방사선
effect
치료
and the
항암
late
치료가
onset side
그리고
effect
끝나고
after
나서
radiation therapy.
정기적인
So you
진찰이
need to have a
중요하겠고요.
routine
또한
follow-up
스스로
during treatment
부작용을
and after
면밀하게
treatment.
살피고
And you should
관리하는
yourself
것이
take the lead
중요하겠습니다.
in looking out for side effects and manage them.
경청해 주셔서
Thank you very
감사합니다.
much for your attention.